Hi, my name is Beth Pritchard, and I am Alex's mom. And I was asked to talk to you about our experience raising Alex. And so, what I'm going to do initially is just kind of describe his history medically and developmentally and what we've experienced through that. And in the next video, I'll talk more about some of our choices with therapy. So, Alex was born prematurely, 6 weeks early, which is not tremendously early, but he was 4 pounds, with a genetic disorder called CHARGE syndrome. We were not aware of this while I was pregnant. My understanding now is that there are some tests that might not uncover the specific genetic issue per se, but would know that there was some sort of issue going on. But in any case, we had no idea. We were aware of the issue with his kidney, but we were told it was minor and common. So we were quite surprised when he was born prematurely and then diagnosed with a very significant genetic issue. If you go look up CHARGE on the internet, what you're going to see is it's a very disparate group of kids. It involves, CHARGE is an acronym. It stands for eyes, ears, heart, nose, kidneys, hormones. Essentially, each letter stands for a potential affected area. But I'm not going to go through every single medical issue because it would take all day. But the important things for Alex were that he had a large hole in his heart that had to be fixed via surgery. It was at 10 weeks of age. His heart was repaired, and he's extremely active. And although his heart is very anomalous, it functions very well at this point. He, at 6 months of age, after we got past sort of the life-threatening issues, he was diagnosed with profound hearing loss. He does wear hearing aids, and he does hear very well aided. So that's a huge blessing. All his other medical issues, like I said, have been dealt with. He did spend 4 months at Duke University Medical Center. So that's a pretty lengthy period for an infant to be pretty much sedated and lying in a hospital. So, you can imagine that has had overall effects on his life. He did leave Duke with a feeding tube. He was aspirating his swallow, and he was not interested in taking a bottle. So he was fed by G-tube. We pulled it at age 5.5. So we had many, many years of feeding therapy. He never took more than a couple cc's from a bottle. So that was, that has significant ramifications with respect to his speech in terms of the oral motor delays that he experienced because he wasn't eating normally. From a family perspective, I was planning on working from home when he was born. So this completely upended our plan. I had to quit work. I did go back, and I do still work part-time, a few hours a week at home for a software company. But like I said, that completely upended our family plan and financially. So in any case, Alex started PT, OT, and speech pretty much the moment that he left Duke. He has some anomalies in his ear and his vestibular system and balance, so he needed significant physical therapy. He didn't walk till he was 2, and he was extremely unsteady for many, many, many years beyond that. So walking is not an issue now, but it was for many years. Like I said, he got his aids at 6 months of age. So for at least the first 6 months of his life, he was not hearing anything, not taking in any auditory input or very little. And we started the feeding therapy. Now, we did pretty early on also start sign language with him. We didn't know whether he would be able to speak or not. So we did a lot of sign with him, and we were encouraged to do signed English, which is different from American Sign Language. You sign every single word that you say, as opposed to ASL. So we did a lot of manual communication with him when he was little. We don't now because he's verbal, but it was really, really valuable. If you ask me, it gave him some ability to communicate what he needed. Alex immediately was diagnosed with sensory integration dysfunction, certainly because of the vestibular anomalies. He's very much the sensory seeker. Constant movement, constant touching, a little bit of aversion with touching certain things, and certainly aversions with eating with respect to textures. That took a lot of years of feeding therapy, but we got beyond that, and he eats everything now. He's not crazy about crunchy food. I suspect when he crunches food, it's loud in his ears. but nevertheless, he can't eat everything, and he's a wonderful eater. Significant attention issues. He's got one of the poorest attention spans I've ever seen in a child. And he developed, pretty significant, after about age 2, behavior issues. I'm sure the communication and the attention all factored into that, but it was very hard for him to process the world, and he would do a lot of things to act out when he was stressed. So we did pursue medication for all of these issues. It was a very difficult process. Most medications caused him really significant side effects, from moodiness to sleep disturbances to exacerbating tics for him. After about 4 or 5 years, we did find one medicine that just gives him a little bit of calming, which is all we were really looking for, without significant side effects. So that was a very difficult process. And I do want to mention that sleep is a very difficult situation for him. He is not a great sleeper. He wakes up every night in the middle of the night, and we've worked very hard behaviorally to teach him how to go back to sleep, how to put himself back to sleep. Medications for sleep were not something we wanted to pursue. We tried them a little bit. They didn't work for more than a night or two anyway. So we really didn't want any more medication than necessary in our lives for lots of reasons, but they all cause side effects too. So in any case, I want you to keep in mind the families that you're working with could very likely be extremely sleep deprived. Not just the kids, but the parents as well. So everything is harder when you're not getting sleep. And we went years on end with very, very poor sleep. So just something I want you to keep in mind, especially kids on the autism spectrum can be extremely poor sleepers. So at this point, let me just give you kind of his full diagnosis, because he's not a typical anything kid. So I'll provide you with that, and then a few of his strengths, and then we'll take a break. So at this point, we go to the Carolina Institute for Developmental Disabilities in Chapel Hill, and they're outstanding. It's a psychiatrist-psychologist team that we work with, and their full diagnosis of Alex is, aside from the CHARGE syndrome, is significant hyperactivity, significant sensory issues, a severe language delay, some autistic characteristics. He has a mild manifestation of Tourette's syndrome, which would be your tics, motor and verbal tics, which wax and wane, and they morph from one different type of tic to another. However, he has normal intelligence in the right environment, which is the crucial piece of information with respect to that. He tested out his IQ testing. He is absolutely 100% in the normal range, which means he can learn, which has absolutely been our experience with him. He is capable. He's extremely bright and capable, but the circumstances have to be appropriate, and that's pretty tough to manage. He is verbal. He does now speak in full sentences. He clearly has good receptive language, although he doesn't understand everything. But I expect him to understand the typical things that you would say to a child. He is 11, by the way. I'm not sure if I said that. And his strengths are reading. His decoding skills are outstanding. He just finished 4th grade, and his teacher said on multiple tests he is reading at a 6th grade level. So his actual decoding is fantastic. I attribute that potentially to, we read with him a ton when he was little. I mean, constantly, and he loved books, and he pretty much taught himself to read. We worked on letter sounds, but I didn't teach him anything about reading. And he can sound out words he doesn't know or make good guesses. So his reading is outstanding. We've taught him how to type in order to maximize the use of written language, and he's really good at typing, really proficient. And he's also pretty good with his math skills as well. And a lot of that, I think, is just rote, and so it's not too hard for him, and it involves some level of memorization, which I think he's good at as well. So anyway, that's my sweet, beautiful, red-headed, freckle-faced boy.